Getting diagnosed with endometrial, which is also known as uterine cancer, can be scary. Several questions come to mind, like what's next and is it treatable? But when you get the facts and learn more about what to expect, hopefully that can help lessen a patient's anxiety to a degree. Today, my guest is Dr. Stephanie Sullivan, Assistant Professor in Gynecologic Oncology at VCU Massey Cancer Center. Here to talk about what you need to know about endometrial, also known as uterine cancer, and how the team at VCU Massey Cancer Center can help you with your diagnosis, treatment, and care. Note that in this episode, endometrial cancer and uterine cancer are used interchangeably. Welcome to Healthy with VCU Health, where experts from VCU Health share their knowledge, cutting-edge research, and the latest innovations to help you achieve optimal health and wellness. Take control of your health. I'm your host, Maggie McKay. Dr. Sullivan, thank you so much for being here today. Let's get right to it and find out if there are certain lifestyle factors that increase your risk of endometrial cancer.
Hi, thanks for having me. There are certain lifestyle factors or risk factors that increase endometrial cancer. The biggest one is obesity. So uterine cancer is 3 times more common in women who are overweight or obese than women who are not. Age, certainly being over the age of 50 and over the age of 60, increases your risk for endometrial cancer. And a family history with multiple family members with colon cancer or endometrial cancer may put you at an increased risk for that cancer. Additionally, hormonal therapy, so having extra estrogen with your uterus in place, can increase your risk for cancer.
And endometrial cancer is not the same as endometriosis, is it?
Correct, it's not the same. Endometriosis is a benign or non-cancerous condition where the inside lining of the uterus gets out into the peritoneal cavity or other areas of the tubes, the ovaries. Endometrial cancer is a cancer or malignant condition of the inside lining of the uterus.
Okay, good to know. So uterine cancer, what are the potential symptoms?
The most common symptom of uterine cancer is vaginal bleeding. So most women are diagnosed after the age of menopause. And so after the age of menopause, women should not have any bleeding. And it's important to know that the bleeding doesn't have to be a lot. You don't have to have a heavy bleeding or significant, like having a period again. Any bleeding after menopause is not normal and should be evaluated by a doctor. Additionally, women who haven't gone through menopause yet but who have irregular bleeding or heavy periods should also be evaluated by a doctor.
So when a person is diagnosed with endometrial cancer, what are the treatment options?
So treatment varies depending on the stage of the cancer. The good news is that most endometrial cancer is diagnosed early before it spreads to other areas. And most women, all they need is surgery. Some patients might need additional treatments after their surgery, like chemotherapy or radiation therapy. But if we can catch this cancer early, most people just need the surgery to help treat the cancer. Most surgery is performed with small incisions, so using a minimally invasive technique. Robotics is a minimally invasive tool or a laparoscopic tool that we use for patients to allow a faster recovery, shorter hospital stay, and fewer complications. Sometimes cancer can come back or patients can have a recurrence. In these cases, recurrences or the return of the cancer is treated with chemotherapy, immunotherapy, radiation therapy, or some combination of those treatments. At Massey, we have several clinical trials that allow patients access to the newest and most promising treatments available.
Are survival rates the same for women of color?
Unfortunately, no. Mortality rates among Black patients is 2 to 3 times higher than that of their white counterparts. Black individuals develop a greater proportion of aggressive subtypes of endometrial cancer and tend to be diagnosed at later stage. At Massey, we're intimately aware of these disparate outcomes and are taking an active role in both researching why the outcomes are different and implementing concrete interventions aimed to elevate the care of Black women. For example, 96% of participants in the research trial for the most effective treatment in recurrent endometrial cancer were white women. We're concerned that this treatment may be less effective in Black women, which is why we opened the only clinical trial dedicated to Black or African American women with recurrent endometrial cancer.
Dr. Sullivan, could you talk about what a patient could expect from the VCU Massey Cancer Gynecologic Oncology team?
Absolutely. We provide a level of expertise and experience found only at the top 4% of national cancer centers. Our team works with you through every step of your diagnosis, treatment, and survivorship. This is different than some other practices where doctors may only do the surgery. We are your partners in your care and focus on your needs and wants and not just the disease. In addition to a dedicated doctor and nurse, your care team will include a nurse navigator, a social worker and counselor, a nutritionist, and a dedicated clinical trials team to help you with every step of your cancer journey. We provide advanced minimally invasive techniques, including specialized training in robotic surgery, even for the most complicated patients that may have been told that they couldn't get surgery.
It sounds like Massey has it all covered. So I think somebody getting that diagnosis, going to Massey, would feel like they're in good hands.
We strive for that, and I think we provide certainly a high level of care and expertise and look forward to helping patients through this cancer journey.
Is there anything else you'd like to add to someone who's facing this?
My final words would be words of hope, that I hope that women everywhere learn about endometrial cancer, know about endometrial cancer. It's the most common gynecologic cancer. And if we can raise awareness that it's not normal to bleed after menopause and it's not normal to just have heavy periods that you put up with. If we can get women talking about this, get women into doctors, we can help catch cancers earlier, cure cancers, and find families that have an increased risk for cancer so that we can work towards eliminating or reducing cancer in women. There's hope with this cancer, and we are here to help you.
Thank you, Dr. Sullivan, for sharing your expertise. I hope the information you shared will be a comfort to women facing this diagnosis, and I'm sure it will. And thank you for listening to Healthy with VCU Health. To learn more about endometrial, also known as uterine cancer, and other gynecologic cancer care at VCU Massey Cancer Center, visit masseycancercenter.org. That's MASSEY cancercenter.org. Or call us at 804-828-9080 to make an appointment. 804-828-9080. And to listen to more podcasts from VCU Health, please visit vcuhealth.org/podcasts. Thank you for checking out this episode of Healthy with VCU Health. I'm your host, Maggie McKay. Be well.